decrease in the frequency of infections that will come up as a result of transplant, more tolerant HLA mismatches, which means, sort of think of the naivete of birth. You're innocent at birth, and then you come into this world and you learn things and you pick up bad habits. Well, your body is the same way. Your immune system at the time of your birth has a naivete to it, so that it can adapt into your brother's body, your sister's body, another family member's body, and become that person in a more ready way than when we're using the bone marrow of children or of adults. Because we're taking it at that moment of birth, it actually matches better. It is less likely to be rejected from that person. And then overall, there's a better immune function long term. This is just talking about what the stem cells are. Because when we say stem cell, then it can come from the umbilical cord, the bone marrow, the blood, or the embryo. But again, we are specifically talking about when it comes from the umbilical cord, and that's why we're saying cord blood banking is what we're talking about. These cells are the master cells that are used to build every other kind of cell in the body. So whether we're talking about the liver, or the skin, or the muscle, the blood, or the nervous system, the brain, the heart, it all comes from an originator cell. And this is what's in the umbilical cord. So again, let's use yourself as the model. We know that we are able to affect cure with cerebral palsy. And also youth is restorative. So the younger that we affect that transplant, the greater the likelihood that it's going to immediately take effect, and we notice a difference in cure in that person's body. For you, the first thing we would have to do is to find a match. Because when you and I were born, this was not available. So nobody in our age group has cord blood cells that were preserved for them. Now just imagine the children that are being born today, they have a whole new opportunity, a whole new reality. Should they suffer burn? Should they develop disease? Should they develop cancer? They have options that we did not have. So for you and I, we're looking to the National Registry to see, is there a match for us? If we give birth to a child, there is the potential that there is a match for us. In banking the cord blood cells, there's research now in, okay, I may have collected this volume of cells, and this volume may be enough to cure someone up to 100 pounds. But what if I need to cure 3 people in the family? Or what if the person needing cure is 200 pounds, not 100 pounds? Can I take the cell and multiply it, make it multiply itself? We're doing research on that now, cell amplification, so that that can also be a strategy, finding a match, amplifying the cells, affecting the transplant. Lawrence Seiler would be cured.
Yep. Hopefully that happens.
Brilliant question. Brilliant question.
Next.
This one we talked about. This is the current uses of the cord blood cells. We use them in blood disorders. Sickle cell anemia, aplastic anemia, Fanconi's anemia, beta thalassemia are all curable. We use them for malignancies, including multiple myeloma, and we use them in metabolic disorders. And there's research now using it for the spinal column, the heart, and for diabetes. And this we talked about. And this is just showing, once again, what we're already doing research and showing promise in: eye disease and blindness, diabetes, brain and spinal cord injuries, stroke, ALS, muscular dystrophy, and liver disease.
Parkinson's.
Parkinson's, very important. There's
So
research
Michael J.
already
Fox
ongoing.
would be cured then.
There are so many people, even in the celebrity community, that have been affected. It's universal. The effect of disease does not discriminate because of income or because of education. And that is the beauty in being able to universally utilize this. So this is looking at the heart. And there already are studies underway that have shown promise in being able to restore the heart to its original function after a heart attack.
Okay.
Using the cord blood. There already are studies showing, again, promise in all of these categories in brain regeneration. Regeneration means going from a damaged state to a completely restored, whole state that is disease-free. In type 1 diabetes, your pancreas is no longer functioning and of use to you, and we have shown evidence of restoration of the pancreas, and therefore cure of diabetes type 1 with the use of the cord blood cells. And finally, this is showing that even our blood vessels, because again, when we have a sperm and the egg in the womb create a pregnancy, everything is created out of nothing. And those cells that create something out of nothing are the very cord blood cells we're talking about. So even blood vessels, when we have damage to our blood vessels, peripheral vascular disease, etc., we have shown evidence that the cord blood cells can go into the body and make all new blood vessels for our bodies.
We're going to wrap it up.
Okay. Well, I would like to thank you
Thank
for
you.
joining me on this edition of Special People, Special Issues. It's been very informative, and come back again. When we come back, the Special People, Special Issues Bulletin Board. Stay tuned.
Can you tell which of these children was not born free? Can you tell which of these children was not born equal? Can you tell which of these children does not deserve to be treated with dignity? We can't either. Human right number one. We are all born free and equal. What are human rights? Find out at youthforhumanrights.org.
Honestly, dude, I did the most shocking thing today. It was just something I never thought I'd do.
Did your parents find out?
My mom cried.
What'd you do?
Now let's turn to the Special People, Special Issues Bulletin Board. It contains numbers and information featured on today's show. For more information on Dr. Afriye Emerson and her work, you can contact Dr. Afriye Emerson, OBGYN, and she's also a speaker and founder of La Doctora's Angels, a cord blood banking awareness campaign. You can reach her at www.afriye.com. That's www.afriye.com. Well, that puts an end to this edition of Special People, Special Issues. Soon I'll be cured. Stay tuned. I'm Lawrence Seiler. See you next time.
The views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Coming up on this edition of Special People, Special Issues, the second part of this series on cord blood cell research. We have Dr. Afriye Emerson from Hackensack Medical Center. Stay tuned for this medical edition. Welcome to this edition of Special People, Special Issues, the program that for the past 11 years has always focused on the needs, concerns, and achievements of the differently abled. I've always been your host, Lauren Seiler. On this very powerful medical edition, we have been focusing on cord blood cell research. This is the second part of a three-part series. We have Dr. Afriye Emerson from Hackensack Medical Center. Thank you for joining us again on this edition of Special People, Special Issues. Thank you so much for coming in.
It's an honor to speak to your viewers, Larry. Thank you.
Okay. Last time we gave a general overview of cord blood cell research. Can you basically tell us again what that is?
Okay, and indeed we gave the viewers last time the overview. And the overview is that the baby is born into the world. Healthy, we cut the cord, and at that point, the umbilical cord is still connected to the placenta. Mm-hmm. And rather than discard the umbilical cord and placenta as medical waste, we have the opportunity, ever since about 1988, to preserve the cord blood, and that means we're collecting it either privately for the family or it's being donated to the public. So whoever delivers the baby, right after the baby is safe, decides to collect, the same as you would draw blood from a person, from the umbilical cord, the blood. Okay. And that blood, again, is then taken to a laboratory, frozen, and able to be retrieved at a later point to cure disease. And there are over 70 diseases that are curable using the cord blood cells. Okay. Some of those diseases are sickle cell anemia. So there are many children who've been born with sickle cell anemia, who are dying essentially of sickle cell anemia, and who then can be cured of their disease permanently. Okay. Using the blood from the umbilical cord. Another example is leukemia.
Cancer.
Cancer. And we know that leukemia is something that affects hundreds of thousands of children across the country every year. If a child has leukemia, they are primarily treated with chemotherapy. Mm-hmm. Many children are not able to be cured by this. And so the doctors that are treating that child's cancer have an opportunity. If that child's cord blood was saved, if that child has a sibling whose cord blood was saved.
Or siblings.
Or siblings, the more the better, because the more times a family banks cord blood for a child, then each child that comes in increases the probability of a match for all of the siblings.
Okay, now what happens if there can't be a match? Is the child put on a registry or a list? But how long does that go on for?
That is such an excellent question for your viewers. If there is no match, number one, if the child doesn't have any sibling with cord blood, mm-hmm. or there is a sibling with cord blood but it doesn't match, then the child would look in the National Marrow Donor Program, which has been created in our country by the government. Since 1987, the National Marrow Donor Program has a registry, as you mentioned, and that registry keeps track of any donation to the public of bone marrow that can be matched to children and adults mm-hmm. who are seeking cure to their disease. So the child would be put onto that registry. And what is the likelihood that they would find a match? If it is a Caucasian child, about 70%. If the child is a child that is of color, then the probability of a match decreases very significantly. Mm-hmm. If the child is mixed ethnicity, then the probability decreases even more rapidly. So that there are certain subpopulations ethnically which face as low as a 4% chance of matching.
Why is that? Is there a particular reason, or can you tell our viewers that?
Well, because we're not donating enough. As a country, as Americans, the donation of bone marrow, if we ask everybody we know, have you donated your bone marrow ever? Most people are going to say no. And so that's problem number one. Donation of blood, we've done a much better job than we were doing, let's say, 30 years ago. But when it comes to the cord blood, this is what's so exciting, and this is why it's so magnificent that Special People, Special Issues is featuring this 3 times to educate your viewers, is because the cord blood is a no-brainer. When a baby is born into the world, there's no use for their umbilical cord after that point, unless we preserve it. Now, imagine a country in which every child born donated their cord blood to the public.
Then you would have a lot of diseases or informalities, you know, no more.
You got it.
For example, you mentioned offset, that, because today I want to talk about several things. We spoke about cancer.
Yeah.
What about diabetes?
This is exciting. There are 2 types of diabetes.
Type 1 and type 2?
Type 1 and type 2. Type 2 is completely avoidable. Type 2 happens generally to an adult, maybe middle-aged adult, and the adult often is obese, and that person may or may not need insulin.
How obese does a person have to be to get insulin?
It's not an exact proportion, weight in proportion to how much insulin you need, because there are many different forms, again, of the diabetes. But type 2 diabetes, for the most part, is an obese population. And so that, again, you can prevent that by weight management and nutrition and healthy living. But type 1, you can't avoid.
Now
You can be born with it. You can develop it as a child. You can develop it as a teenager or as a young adult. You can be thin and healthy and athletic, and you get type 1 diabetes, and it's the worst one to get of the 2 because you have to take insulin.
Now I'm going to ask you about this. How can one live or be, living healthy in terms of America? Because there are thousands or hundreds of fast food restaurants in America. So how is one eating healthy if America's eating on the go? I mean, this is ridiculously important, for us to tell America that, look, you have to eat healthy so you don't get diabetes, you don't get cancer, you don't get these things.
You got it.
That kind of thing.
It actually is the most important message for your viewer, is to understand what control they have in preventing their own disease onset. If you are born into the world as a healthy person, that is amazing. And if you are born into the world with any abilities whatsoever, which we all are, and again, that's the beauty of the show, is that everyone has certain abilities that they are coming into the world with, be they mental, physical, through their senses, or through their hands, or through their experience, or through what they bring to other people. When you have it, you have to protect it.
Now, on the table, I noticed that you brought a diagram of the human body. Can you kind of explain how the cord cell blood works through our own system?
Okay, I'm going to finish what we said on diabetes. We explained the 2 types of diabetes.
Okay.
Type 1 is the worst. And type 1 diabetes is your pancreas. And your pancreas at this point is not producing the insulin that you need to live, to survive. We have studies that have been published that show that type 1 diabetics can be cured with the cord blood. And from 2007, the Journal of the American Medical Association has published literature showing that even adult stem cells, meaning we're taking from an adult human being the cells in their body.
At what age are you guys?
Any age.
From 20 on up?
That's right. Adult population can take their own stem cells and cure diabetes. Type 1 which is the battle that we are fighting the most as a healthcare industry. Type 1 diabetes is the one that is the killer of people because, again, it is affecting children, teenagers, young adults. It's not preventable with the healthy living that we mentioned before.
Okay.
So again, diabetes, cancer, these are two of the diseases that are curable, but it's not just one type of cancer. There are many types of cancer that can be cured with the cord blood, and also type 1 diabetes, and those studies are still ongoing. And your viewers can go to websites to learn more about how to cure type 1 diabetes. www.cordblood.com
Okay.
is one website that they can go to and learn about how to enroll their family members who may have type 1 diabetes, and how to, as a pregnant woman, bank the cord blood of their children in the hopes of, as you said, eliminating type 1 diabetes completely. We can eradicate disease if everyone is participating in cord blood banking.
Now you mentioned, you mentioned diabetes, okay? There's the good blood and the bad blood with the hemoglobin and all of that. Infusement, how does that work with cord blood?
With,
How do you
right.
how do you test both the good blood and the bad blood?
So I would describe it a little differently, that in our blood there are various parts. There are red blood cells, there are white blood cells, there's the plasma, and when we collect the cord blood, all of it's there, like you said. So then there is a process that cord blood has to go through in order to be prepared so that you have isolated only the stem cells. And that process is a very complicated process that takes place in the laboratories. And those laboratories then are having staff that are trained at how to use the centrifuge machines that are used to isolate the stem cells. All of the, quote, the bad blood, that would be infection. If the blood is infected, then it's going to be tested, and once the infection is detected, the blood cannot be used. So if the blood is found to be free of infection, then the stem cells are isolated through centrifugation process. And after the centrifuge process and the isolation of the cord blood stem cells, then it is frozen in tanks where it can be stored indefinitely. And again, how long can we use it? What's the lifespan?
You mean cryogenically?
You got it.
Freeze the blood.
Yes.
Okay.
Yes. How long can we use it after that? We've had studies to show that at least for several decades, but the probability is for much longer.
Okay. Well, let's take a break and continue after this. More on stem cell and cord blood cell research with Dr. Afriye Amerson when we come back after these messages. Stay tuned. Welcome back to Special People, Special Issues. Let's continue the discussion that we're talking with Dr. Afriye Emerson of Hackensack Medical Center. Welcome back, and let's continue the discussion on cord blood. What other diseases? Now, I'm going to ask you a question, and you're probably going to tell me no. Does cord blood handle or deal with seizure disorders like epilepsy?
The answer, you're absolutely right in your intuition that the answer is no at present.
And why?
We can go back to the model that we used. The cord blood cures that we are currently able to do are all involving situations where there is an injury to an organ,
Okay.
or the cells of an organ have, quote, malfunctioned. And when there is a malfunction of the cells, then the cord blood cells are able to go to that area of the body. Heart disease, Alzheimer's disease are two diseases that are currently under research because there can be an injury to the heart. There can be an injury to the brain.
So with Alzheimer's, if someone loses their memory, for example, the heart can also stop pumping, correct?
That's right.
Okay.
And in both of these situations, medicine is able to identify, to point to where the problem happened. The problem with seizure disorder is that we cannot point to where the problem happened. A person can have a normal brain that is not damaged in any way, and the cells are not damaged in any way. So the cord blood may not be applicable. We don't know. Our children may discover and figure this out, but that's the realm of the unknown in science right now. But what we do know is that, again, you can have a completely normal brain and suffer with seizure disorder because there is some electrical firing that is occurring in that normal brain to cause the seizure.
Okay. You mentioned also the registry. Can you explain about the registry or the website that the registry is on?
Absolutely.
So people can get a chance to write in or send emails?
Absolutely. So let's go over some facts and figures. The National Marrow Donor Program Registry is a registry that includes more than 6 million potential volunteer marrow donors and more than 50,000 cord blood units. And it is listed through bone marrow donors worldwide. So National Marrow Donor Program is what your viewers should seek in terms of looking at the website and having an understanding of what this is. It serves all communities, and the registry has been serving and keeping track by ethnicity of the availability.
Caucasian, mixed, etc.
Yes, yes. So Native Hawaiian, Hispanic, American Indian, Asian, Black, and what the numbers are in terms of participation of various ethnicities in this registry. And again, what it shows is that as we look at mixed ethnicities, there is decreased participation. And a lot of that has to do with the fact that people do not want to donate their bone marrow. It's painful. You have to be in pretty much perfect health in order to qualify, and the procedure takes time. But when a child is born into the world, you already have everyone that is needed present for this amazing opportunity that is once in a lifetime for that particular child. That is the perfect opportunity for all ethnicities to participate equally in the National Marrow Registry Program by donating the cord blood. And the viewers can learn how to participate in this by looking at the National Marrow Donor Program.
You also mentioned the regenerative medicine registry. Can you explain about that as well?
Yes. Regenerative medicine means we are reinventing something that you already had in creation and that was damaged. So it's an extremely exciting area of development in science. And in this area, there are studies undergoing that are looking at hearing loss. So we know that many children are born with normal hearing, and then due to some injury or some accident or some illness,
And they lose their hearing.
they lose their hearing. If that child has banked their cord blood, not donated it to the public, but privately banked it so that they have it for their use, then they can use that cord blood to potentially restore normal hearing to that child. And your viewers can also, again, go to www.cordblood.com/hearing loss to learn how to participate in that study.
Are there any other diseases or informalities that cord blood cures that we haven't mentioned as of yet?
In the area of regenerative medicine, it's also important to say that there are studies that are undergoing that are looking at vision and the loss of vision through various means. There are also studies that are undergoing that are looking at the spinal cord, which can be injured. We all know about Christopher Reeves, and that paralysis is something that strikes people and can be devastating. There are studies that look at both adult stem cells as well as looking at the cord blood cells in being able to regenerate a normal spinal column after injury. And then also the cord blood, again, is having research in looking at skin and tissue regeneration for burn victims, for example.
So in other words, if someone was in a fire,
Yes.
or a really bad fire, had
Yes.
second, third, and fourth degree burns, how would that help someone with cord blood?
The person can explore through the same modalities of the other illnesses that we talked about, using their healthcare provider to learn about whether or not, number one, using a transplant of stem cells is going to be useful to them. And then finding a match. And finding a match, that person would then be able to receive a transplant. And the transplant is a very simple procedure, almost like receiving a blood transfusion.
What are the future, or how does the future hold for cord blood recipients or the registries itself? Because this is an ongoing process. Can you explain to me how the future holds for cord blood cell research itself?
Well, I think the future is extremely exciting for cord blood research because just in the past 20 years, we have been able to discover cures for over 70 diseases. The participation can increase now exponentially, and what that will do, as you stated before, is it will increase the likelihood of match.
Now, why are people afraid, though, of donating bone marrow and, their organs to cord blood cell research? Why are people afraid?
I don't think they're afraid. I think they're uninformed.
Okay.
I think that people do not know that when a child is born, they can bank the cord blood. And then when it comes to bone marrow, as I said, I think that there are many barriers to that. But in terms of why are we still as a nation having less than 5% participation in banking the cord blood, it's lack of awareness. And so it's with that understanding that I brought in for you information about a campaign that I've started to raise awareness on cord blood banking. And so it's called La Doctora's Angels, and I am fluent in Spanish, so I chose that name because it will include the Hispanic population in participation. And what it does is it utilizes nurses who I think are leaders in the community in terms of advocacy and education. And these nurses are going out into the community and educating one woman at a time that they have the option to bank the cord blood of their child when the child is born, not to just throw it in the garbage as medical waste.
Is there anything else that you would like to say about cord blood cell research before we end? that
Well,
people should know?
Just finally, that everyone that is a viewer, whether they themselves are pregnant or have a family member pregnant or simply know someone in their community that is pregnant, should absolutely, as a result of this show, go and make sure that that person knows that they have the option to either donate it to the public for free or to privately bank it and keep it for the cure of disease within their own family.
Are there any other cord blood cell registries that people should know about that we haven't mentioned?
No, you have comprehensively covered it.
Okay.
Lawrence Styler, thank you.
Okay, no problem. Well, I would like to thank you for joining me on this second part of this series on cord blood cell research. When we come back, the Special People Special Issues Bulletin Board. Stay tuned right after this.
These things we count on every day started as ideas. Ideas from the minds of African Americans. Support minority education today so we don't miss out on the next big idea tomorrow. The United Negro College Fund. A mind is a terrible thing to waste.
Hey, how's it going?
Sir, are you okay?
What? Oh, this? It's probably nothing. I'm sure it'll go away.
Go away? But, sir, that can't be good.
No, it's cool. Really.
Do you want a napkin or something?
Everything's fine. Thanks.
You wouldn't ignore this. So why ignore the signs of a stroke? At the first warning signs, call 911 immediately. Because time lost is brain lost.
Now, let's turn to the Special People Special Issues Bulletin Board. It contains numbers and addresses featured on today's program. For more information on Dr. Afriye Amerson's work in general, you can contact her at www.afriye.com. But for more information on her cord blood cell registry, La Doctoras Angels, in Spanish, that is dealing with parents of Spanish-speaking families, you can also contact her at www.afriye.com. Also, for information on regenerative medicine and hearing loss, you can go to www.cordblood.com/hearing loss. Well, this puts an end to this edition of Special People Special Issues. As always, I'm Lawrence Seiler. See you always next time. Stay strong.